Kia ora, good evening. GPs are concerned that a sharp decline in our children's vaccination rates could be the catalyst for a measles outbreak in Aotearoa. They say the focus on fighting COVID has resulted in a lack of attention on getting Kiwi kids immunised, especially among tamariki Māori. Alexa Cook has the details.
Putting on a brave face. 4-year-old Mika is getting his diphtheria, tetanus, whooping cough and polio vaccines.
That seems we are fully immunised.
But scenes like this have taken a dive in the past 2 years. Child immunisation rates are down and GPs are worried.
If we don't get the kids' vaccination rates up, then we will see diseases coming through in the future that are really nasty and that will be hospitalising kids.
At the end of 2019, immunisation rates for 2-year-olds were at almost 92%. By December 2021, that had dropped below 84%. For Māori, immunisation rates dropped nearly 18% over that 2-year period to just 69.7. GPs are warning of a measles outbreak.
As the rates go down, then your risk of an outbreak is higher.
Rates are low because COVID has zapped resources.
We were all focused on COVID. We're all focused on getting people vaccinated, and what we weren't watching really carefully was that data going down around immunisations.
We had a big job to do. We had to set priorities. We had to make a hard call that we would pause the MMR campaign, but we're back on board with that now.
Those working at the coalface want a better strategy.
I'm yet to hear from those in the ministry or the DHBs about being invited in to say how we need to fix this.
But there is a strategy for the flu vaccine. The Health Minister taking his shirt off today for the new jab in town.
Well, good. Easy.
$12 million is being injected into the government's flu vaccine campaign. 2 million doses are available, a 40% increase because an influx of flu is expected as borders open.
We expect this to be, to want of a better phrase, a bumper flu season.
Because COVID isn't the only deadly virus to protect yourself and your whānau against. Alexa Cook, Newshub.
Well, epidemiologist Dr. Michael Baker joins me now. And Michael, the vaccination statistics we just heard on Alexa's story, they're really concerning, aren't they?
Yeah, kia ora. Yes, this is a big worry for New Zealand. We know how devastating measles can be. We saw that in 2019 when New Zealand had a large national outbreak that spilled over into the Pacific. We had a lot of children infected in Samoa and 85 died. So this is a disease we don't want to have back in our community.
And has this, I suppose, taken us a bit by surprise? We've been looking the other way, haven't we, trying to get people vaccinated for COVID?
Yeah, I think COVID has taken over our focus at the moment on infectious diseases, but we have to remember that measles can be almost as devastating. It's actually slightly more infectious than COVID-19, and the only reason that people don't think about it very much is we've had such success with controlling it with vaccine.
Do you think, Michael, that some of the vaccine hesitancy or the distrust that we've seen around the COVID vaccine could be playing a role here too for parents?
Yeah, well, I'm quite disturbed by the total disinformation that's put out about vaccines. These are vaccines in some cases we've used for decades that are incredibly safe. We wouldn't be using them across the globe. And remember that they've succeeded in eliminating measles across many countries in the world, including New Zealand, that currently has eliminated this infection. So has Australia, so have many other high-income countries. So we don't want to go backwards with this virus.
Well, how do you deal with, I suppose, that hesitancy around vaccines more generally?
Well, I think it's important that we have those conversations with our whānau, our friends, people we care about, particularly those who've got young children, and just reassuring them that almost everyone in New Zealand has for decades successfully and safely had measles vaccine. It's an absolute lifesaver, and it's very sad to see us going backwards and basically losing faith in something potentially with no justification at all.
Yeah, and we have seen that happen in parts of the United States and Europe. And I suppose it becomes more important to get kids vaccinated against measles as our borders open up again, doesn't it?
Oh, very much so. I mean, New Zealand has obviously eliminated transmission of lots of things in the last 2 years, including influenza as well as COVID-19 for much of that time, and measles. I think we've only had one case in the last year or so in New Zealand. So that's why obviously things will change very dramatically in the next few months as we open up. So we have to be ready for all of these infectious diseases and get vaccinated.
And that's what needs to happen. Does there need to be a big push, another big campaign, Michael?
I think so, but in the end, a lot of it is word of mouth, and I think it's just for everyone who's listening to your program, I think it's just having those conversations with the parents of young children and just saying how vital this is. So at the moment, we have lower coverage in younger children. We also have a bit of a vaccination gap in young adults, 18 through to about 34. So that's the other group who I think are under-vaccinated at the moment.
Michael, thank you.